They have been described as the most powerful lobby group in Australia, feared by politicians from both major parties and at war with doctors. But community pharmacists say they just want to help keep Australians healthy. As Health Minister Greg Hunt negotiates a new 5-year community pharmacy agreement to govern the sector from mid-2020, he is grappling with a debate over strict rules that limit who can own a chemist shop, what services they can offer, and how medicines are priced. The Guild, which represents 5,700 pharmacies, is pushing to be allowed to take on more GP-like tasks, such as giving travel vaccinations and prescribing the contraceptive pill. This week, the Australian Medical Association (AMA) hit back by demanding doctors, as well as pharmacists, be permitted to own chemists. Grattan Institute health economist Stephen Duckett and former Australian Competition and Consumer Commission Chairman Graham Samuel say this sector should be opened up to competition. Professor Samuel, now an academic at Monash University in Melbourne, says Australians are paying far too much for medicines on the government's Pharmaceutical Benefits Scheme (PBS) due to the sector's anti-competitive regulations. For Jane Mitchell, who co-owns the 24-hour Ascot Vale Pharmacy in Melbourne's inner north, the idea of retailers being able to sell prescription-only drugs goes against everything she's been taught about the safe provision of medicines. I've never heard of anything more ridiculous in my life, 7-Eleven are selling Slurpees, she says. We're not selling fruit and veg here, we're selling medication where advice needs to be given. She warns against a race to the bottom on price, saying deregulation would be a slippery slope. But the Guild says its members are highly trained and deeply connected to their communities. It warns corporate owners may put profits ahead of service, and doctors owning chemists may have an incentive to prescribe medicines that aren't really needed. Chemist Warehouse uses a legal loophole to operate its discount chain of 300 stores. The law states no pharmacist can own more than 5 or 6 pharmacies in one state or territory, and has identified 60 regional towns where it would open outlets if location laws were relaxed. There is a Chemist Warehouse 260 meters away from Ascot Vale Pharmacy, where Mitchell has expanded services to offer flu vaccinations and diabetes education, along with a drug replacement therapy program for patients being treated for opioid addiction. Our pharmacists aren't monkeys just giving out medication. There's a whole lot more value to our service, she says. And they want to do a lot more. Pharmacy Guild President George Tambassis, who runs a pharmacy in Melbourne, was in Canberra this week, lobbying for pharmacists to be allowed to prescribe medications including travel vaccinations and the pill, and treat complaints like erectile dysfunction. He wants the government to agree to fund a diabetes screening program in chemists across Australia, after a trial in 363 pharmacies. The Guild has a history of lobbying hard against any proposed changes it believes would disadvantage its members. It donates to both sides of politics and wields the threat of a highly organized election campaign through its network of chemists. Former Prime Minister John Howard in 2004 abandoned a plan to allow supermarkets to own pharmacies after receiving a threatening letter from the Guild. The group's most recent push has ignited the ire of doctors, who warn patients will miss opportunities for unrecognized health problems to be detected if they see their GP less regularly. The Guild says its members are not trying to be doctors who have 14 years as training versus pharmacists 5, but want to work hand in hand with GPs and help ease pressure on the health system. GPs have got huge waiting times, and some practices have got no new patients allowed, Tambassis says. We're not reinventing the wheel here in Australia, there are ample international examples that have gone through this, he says. He points to the Canadian province of Alberta, where pharmacists are allowed to prescribe a broad range of medicines including antibiotics for urinary tract infections. Doctors warn this could result in undetected sexually transmitted infections, while the Guild counters that patients would be screened through a questionnaire and sent to their GP if they were deemed at risk. AMA President Tony Barton says Australia has the best health outcomes in the world, while Canada is ranked 9th. He also questions the usefulness of pharmacy prescribing in regional Australia, which the Guild says will help people in areas where GPs close early or come to town infrequently. Accessing a pharmacy in smaller rural and particularly remote communities can be difficult, Barton says. But Frederick Helkvist, from the Rural Pharmacy Network Australia lobby group, says country chemists just want to be paid for the services they are already performing for free, saying an increased workload is threatening their viability. We are being expected to give a lot of advice in areas like wound care, skin care, sexual health, soft tissue injuries and dental care, addictions and diet, he says. The Guild wants the federal government to get rid of a rule that allows pharmacists to discount pensioners' PBS scripts by $1, something only discount chemists have been providing. Instead, the Guild is lobbying for a $1 reduction in the legislated $6.50 price, called the patient co-payment, a measure that would cost the federal budget $500 million over 4 years. Tambasa says for pensioners on 5 or more medications, the discount may help ensure they take all their pills. They come into pharmacies and say, "Which is the one I don't really need? Because I really can't afford 4 or 5 this month. So why not support a previous government plan to allow patients to pick up 2 scripts at once?" The government shelved the idea before the election, after the Guild took out a full-page advertisement in The Australian. The measure would have the cost of more than 143 low-risk medications for pensioners, essentially making the second pack free, as the government would pay the pharmacist only once to dispense both packs. Tambasas says making patients come to the chemist each month means there is better oversight by their pharmacists, and instead suggests pharmacists could prescribe the second pack to save the patient another visit to their doctor. Hunt says he is committed to leading early and inclusive negotiations for the new agreement, which will be patient-centered, with a key focus on consumer access to affordable medicines and community pharmacy services that deliver outcomes. He makes it clear the government supports the model of pharmacists owning pharmacies. Deregulation advocates point to countries such as the United States and United Kingdom, where big pharmacy chains CVS and Boots compete on price to deliver cheaper drugs. Boots, which has 2485 stores across the UK, announced in June it was closing 200 stores to cut costs, while CVS announced dozens of closures in May. The Guild says this confirms Australia's pharmacy rules are needed to ensure the right number of chemist shops operate in the places they're most needed, so operators aren't forced to compete on price. Tambasas says it is no surprise Boots is closing stores because they're volume-based businesses and on every corner. He says Australia's restrictions on the number of chemist shops in a suburb or town prevent clustering and ensure pharmacies open in areas of need, with most Australians living within 2.5 kilometres of their local chemist. As a result, in New Zealand, where pharmacy rules are more relaxed, Woolworths has begun offering free scripts to pensioners to get them in the doors of its countdown supermarkets, with some chemists following suit. For competition advocates, it's proof pharmacy deregulation is a win for consumers, but the Guild disagrees. "We used to have zero co-payments here in 1987 when I qualified," Tambasa says. "Pensioners paid zero and what that caused was complete overstacking of medicines at home, a huge amount of waste. If there's no value put on a life-saving medicine, it doesn't matter how dangerous it is or safe it is, unfortunately you get an unbelievable amount of wastage," Tambasa says. A small co-payment stops that if they've got to put their hand in their pocket. That's human nature.